This week on Entrepreneurs, we explore the next generation of health, from medical marijuana to health records and the future of sugar. I'm Jack Delosa, and Entrepreneurs starts now.
This is Entrepreneurs.
Welcome to Entrepreneurs, where we talk directly to the founders of Australian businesses, from startups and small business owners to the icons of industry. Tonight, we speak to the entrepreneurs and experts who are leading advances in health and medical tech. So let's get straight into it. Right now, I'm joined on the panel by Ross Hardy, co-founder of Carol, a digital health platform helping people with kidney problems, and Dean McAvoy, investor and advisor at StartMate. We're actually going to start with something different tonight. Dean being an investor and advisor and a highly well-regarded entrepreneur, and Ross being an entrepreneur seeking capital. I'm going to throw it over to these two so that you can see how having a capital investment conversation works. We're going to see that live. So Dean, I might throw it over to you to have a great conversation with Ross about his business. And
let's go. Thanks, Jack. So Ross, tell me, how did you come across your idea for Carol? Where did it start?
So it started about 3 years ago for me, when I realised that we needed to make the way that we manage complex chronic disease a bit easier, using existing technologies that hadn't quite reached healthcare. I was introduced to Carl earlier this year, and he's actually had a kidney transplant. He was diagnosed at the age of 15, okay. And so he was thinking from his perspective as a patient, how can I make my life easier?
So as a patient, what does he have to do that's so complex? What was the problem that you were solving in the beginning?
So people that are in kidney failure have a really complex life, and there's no cure for kidney disease, and it kills a lot more people than cancer. So Carl has to use multiple tools to manage his life. So this is around his medications, his pathology results, his food, his nutrition. So we want to bring that all into one.
So you built an app when all this complexity of medications, and they see multiple doctors and blood tests, they input that into an app, and then what happens with that data?
So with this information that the patient is actually adding in, it's called patient-reported outcomes. So everything we're doing is all about the patient experience. So when they track their symptoms that are specific to kidney disease, their blood pathology, we're actually giving them ownership of what they do in their life to affect their health. This information can be then shared with the clinicians to help them make better decisions, quicker, faster, and more precise.
So imagine with all that kind of complexity, they're putting all this data in, and normally they would have to collect that with paper or whatever, and then they have, what, a 15-minute interview with their specialist where they have to relay how they've felt, what their blood tests are. So this captures all that. And does it connect it directly to the medical professional as well? Is that how it works? So it's patient input, medical professional output?
It's about both.
Okay.
The technology is to support the relationship between the patient and the clinician. So the patient is feedback directly what they're experiencing with their treatment plans.
Okay.
It prepares them for clinics, so we try and save time and disruption in clinic, but also the information is completely owned by the individual patient, so they can choose to share it with whoever. And that includes pushing it into the future of My Health Record, but via the hospital. So we deal directly with the hospital system.
And what have you done to kind of validate this? Have you gone and tested it with people with kidney disease? I mean, it's great you've got a founder that kind of has the problem firsthand, but have you gone out and validated it somehow with both the hospitals and the patients?
Absolutely, we have. The most important thing I think about healthcare and digital is to involve patients and clinicians from the outset. So we've curated our own little group of patients that we frequently have direct conversation with. We ask them what they think about this, how do they feel with that, how do they manage this. But we've also included the clinicians to say, this is what we're trying to achieve and this is how we want to help you. Tell us some of your problems. So we've built all of that information into this app.
Great stuff. And what about the team? What's your background? What's your skill? And who else is in the team? What do they do?
So I've spent my entire life in healthcare. I spent 10 years as a clinician in the operating theatre and doing some resus and things like that, then 20 years in the medical device industry, a quick foray back into public health, and from a business management perspective. And Carl, he's a very savvy digital marketer, right, as a patient, and we're the co-founders, but we're supported by some of Australia's most distinguished kidney specialists.
Awesome. And final, most important question, how do you make money?
So this is the tricky part because health is very complex. However, our main customer is the hospital at the department level, and we'll have a subscription service on a per patient basis, paid up front annually and not through the monthly cycle.
Really good. I love the fact that you've got deep domain expertise in the team and that you've really authentically connected with the problem. I think that's a really great thing. And then, you know, I think there's some challenges with health and that sort of thing, but more validation and that kind of thing, but you're on the right path. So.
Dean, you've built and exited several startups yourself. You're now an investor and advisor. What are investors typically looking for in this kind of a space?
I mean, generally in the health tech space, I'm super interested in things like the virtualization of health. So there's a lot more access to people being able to see doctors and psychologists through, you know, telehealth and also virtual kind of assistants that can, so that's an area of interest for me. I'm also interested in AI as a huge thing, but and everyone talks about that. It's actually more about the quality of the data that you can access. So AI and quality of data are kind of tied together. And the other thing that I'm interested in is genetic profiling. So if you can understand, you know, you're born with your genes and you have a probability of getting disease from your genes, but if you overlay real-time data about what you do in your life, you can actually get a real-time probability of your likelihood of capturing certain disease. That's super interesting, and there's lots of people kind of doing interesting stuff in that space.
Yeah, it's a fascinating space.
The most important thing though is that the people building these apps look at it actually improving patient outcomes, because if it's doing that, then it's going to help save lives and help actually reduce the costs of health. So that's a good thing.
Dean McAvoy and Ross Hardy, thank you guys so much for joining us on Entrepreneurs.
No worries.
We appreciate it. When we return, we meet an early stage medical startup and explore their growth challenges. Stick around.
You're watching Entrepreneurs. Welcome back to Entrepreneurs.
Welcome back to Entrepreneurs. We are talking about the future of health. On our panel tonight, we have Troy Douglas, the co-founder of Nexpa, a beverage business that is helping us shed our sugar addiction, and Dr. Sud Agarwal, co-founder of Canvalate, one of Australia's largest networks of cannabis prescribing medical clinics. Sud, we might start with you. An incredibly interesting business and business model. I understand you've got a medical background as well. Talk to us about your perspective on the medical cannabis landscape, both in Australia and overseas.
Right, it's an interesting landscape, Jack, for a couple of reasons. First of all, most people don't know medicinal cannabis has actually been legalised in Australia over 2 years ago. So October 2016 was actually legalisation point for Australia. But in spite of that, the dominant cannabis supply in Australia is actually the black market. So the criminals are beating the genuine doctors and their medical suppliers. So it's an interesting market. So we've got an established market of somewhere between $500 million and $1 billion being spent on black market or online pharmacies from overseas buying medicinal cannabis purely for medical purposes. So that's excluding all the recreational use. And then we've got all these multi-billion-dollar companies, predominantly in Canada and North America, USA, trying to export their products into Australia, but failing to make any traction in the marketplace. So clearly there's product market fit here, but for some reason there's no channel market fit. And all these companies with their massive sales forces and 12 to $24 million marketing budgets have been unable to penetrate the market. So that's where we step in. So Canvalate is basically providing patient access and doctor access to these companies.
Talk to us how you do that, because it sounds like it's a really interesting problem, the one you're describing. How do you chart a solution to that?
Right, okay, so the medical industry is already complicated because you've got three customers. You've got a patient, you've got a doctor, and you've got some form of external funding or regulatory body. Right. So you have to please three people. So that's always going to be a challenge. Now, one of the issues is, it's not the patient who's the end beneficiary of the product that makes the decision, it's the doctor. So really you have to think about it from a CX perspective. Really it's all about a customer experience perspective. How do you onboard a doctor successfully to make him feel that this is the right product for his patient? How do you onboard the patient successfully that he agrees to take this product? And how do you onboard the regulatory authority to make them feel that this is the right product for their population base? So essentially, you have to make all three people better off than they were before. And that's where the challenge is. And the other thing that's unique about medical products is essentially the The sales pipeline is very different. So with any other product, you can pretty much trial something and people, there may be early adopters, middle adopters and late adopters. With medical, people are so entrenched in what they've already been using for the last 200, 2,000 patients. So if you imagine a surgeon has been using a scalpel successfully for 2,000 patients, to persuade him to use a new scalpel is going to be incredibly challenging. It has to be ultra perfect and ultra refined with amazing results before he's going to change his practice. So that's what's so unique about it.
There's still a lot of mystery around this area, particularly in Australia. Why do you think it's been so slow to take off and for other people to identify these challenges and lean into them?
Look, very good question. So primarily it's because I guess the industry's been tainted by overseas experience, where there's been a mix of people, both medical and recreational, who've really altered the perception of the market. And the second thing is the major medical bodies in Australia haven't really accepted medicinal cannabis as a mainstream Western medicine. It's still seen very much as a fringe dweller type medicine. But having said that, it's slowly changing. So between October 2016 and say in the middle of this year, there had been less than 1,200 prescriptions prescribed in total. And now, in the next month, we're likely to prescribe over 500. So you can see we're just at the inflection point where prescriptions are increasing. And that's primarily because of medical education. So I guess patients determining their own future, going to doctors and saying, can I have some of this? And also the regulatory bodies now softening up as well.
Fascinating, and I'm definitely going to come back because we're going to need to keep talking about this. Troy, you've built a great brand in Nexpa, which I think has an incredibly noble pursuit, weaning all of us off our sugar addiction, which absolutely needs to be done. This is clearly a rising tide globally. What's driving that trend in your view?
Yeah, I think it's an excellent question, and it's something that at Nexpa we're going 8 years now. So when we first began, we had this vision to create better for you products. It took us 6 years to crack the ability to have our naturally sugar-free natural sweetener blend, and ultimately what's exciting in terms of the trend is I think it's very much an education piece around the impact that sugar has. It's obviously incredibly harmful. And similarly with sugar now being exposed, I think what's fascinating is the big businesses have then made a trend to reduce sugar, but then replace that sweetness with artificial ingredients, which
isn't any better.
No better. Right. So I think what we've always been passionate about is to tackle those high sugar artificial categories with no sugar, nothing artificial innovation, which ultimately can help the health of everyone.
So for those watching who aren't familiar with all the sort of dangers of sugar, just summarise them for us. What's the bad stuff in there?
Yeah, I think ultimately with sugar, the impact on obesity, diabetes is something that's incredibly large and significant. And I think in Australia, it's nearly a third of the population that is impacted to a degree. In diabetes alone, there's 1.7 million people living with diabetes, another 2.4 million people that are impacted from a care perspective. So it's pretty staggering from a health implications. And I think what's important in the food and beverage industry is there's a responsibility now, I think, for businesses to drive no sugar, nothing artificial innovation that also tastes great. So the biggest people with the most harm from high sugar artificial products are less educated and don't necessarily have that availability of a better for you option. So I think that's the role that young emerging businesses can play.
Absolutely. And to extend that thought a little bit further, who is your target market? Is it the super fit, health conscious people, or is it a mass market play?
I think it's a great question. I think ultimately for our business, we're now seeing a lot more data. We're obviously large distribution through Coles and Woolworths and petrol stations and the like, and we target audience, we say that that's health aware, but ultimately to have the impact and achieve our mission, I guess, of having an impact on diabetes and obesity, then it's anybody who is consuming a lot of high sugar and artificial products. So whilst our initial target audience is those that are health aware, the ultimate aim is that we can convert people and reduce the consumption of high sugar and artificial products.
Mate, there was once a time where we didn't know smoking was bad for us, and we drove around without seatbelts in cars. Do you think 10 years from now we're going to look back on sugar in a similar way? Yeah,
absolutely. I think that sugar is already the new tobacco. So I think that more and more people will be realising, and the thing that our business is excited about is we're now reaching out to doctors and nutritionists and trying to get research-backed proof of the physiological impact that high sugar or artificial products are having. So I think it's an important way.
I agree. I couldn't agree more. Coming up after the break, we'll be talking about blue sky opportunities for the future of health. Stay tuned.
You're watching Entrepreneurs. Welcome back to Entrepreneurs.
Welcome back to Entrepreneurs. We are talking with three experts. We welcome Ross back to the panel from the health and medical community. Sud and Ross use their knowledge and experience in the industry to create new products and services, while Troy has been involved in the health and wellbeing movement for many years. So we're going to dig into the trends of medicine and wellbeing and where these gentlemen see things heading. First question I have, I'm going to pose to all three of you. Whoever wants to jump in can. What do you guys see as some of the most pressing needs that are not currently being addressed by the traditional health system?
I think health literacy, i.e. the education around how the population understands the world of healthcare, de-jargonise it, make it simple, because patients that understand more about their health actually become more healthy. So that has a massive effect on population health, health economics, health outcomes for everyone.
As the guy, I guess, from the food and beverage world, I think that from an impact, you can see overseas already with government intervention coming into play. I'm not suggesting that Australia should do that, but I think that there's a responsibility for the health system to encourage multinationals and big businesses to make a move to make healthier, better for you products, so reduce that sugar and reduce artificial. So I think that's an important move.
Absolutely. So what about you? Biggest needs that aren't currently being met?
Yeah, so there's a new trend now, something called supra-normal health. So the idea of wellness. So the idea that you don't just go and see a doctor when you're sick, but the idea you see a doctor proactively when you want to become more healthy. So that's a big sort of push now in sort of most developed countries in the world. And Australia's no different. But we've only got a small segment of the population who are following that trend. And so they're the people that are seeking health beverages, they're the people that are seeking personal trainers. So the question is, how do we change the mindset of those who aren't benefiting from that supernormal health, so they've got more reserve when they do get sick or when they do have surgery?
Yeah. Another question I want to pose to the panel, it might start with you, Sud, is
Certainly.
Working in the health space, you're often, particularly as a doctor, you're often quite literally dealing with life and death circumstances. How do you balance the emotional charge and the moralistic sort of consequences of all that with the commercial needs to drive a business forward?
Yeah, so that's a really good question. And I might bring in what I mentioned before about having the three customers in healthcare.
Yes.
So you've got the cost-conscious regulatory bodies or the funding authorities. You've got the, I guess, the science-conscious and mainstream doctor. And then you've got the patient who's obviously the main beneficiary of all the treatments. So really you've got three different customer journey maps. So if you plot all three independently, you'll notice that the outcomes that the patient wants is probably inversely related to the outcome that the funding body wants. So the question is, how do you please all three? And in general, you'll never get any change happening unless all three parties are at least getting something better than what they had previously. So I think the key is to basically always compromise and to try and find what works for all parties. So there's no point creating the world's best product if it's ridiculously expensive and if it's not supported by doctors, because it's just never going to get through the masses.
Ross, how do you balance those two things in your line of work? Obviously, there's such a cause at the heartbeat of everything you do, but there's also a commercial business that needs to be grown.
Yeah, look, we have direct communications one-on-one with our current early adopters, and it's a really powerful environment. It's really quite fascinating. But for me, the bottom line is that we have to make money, because if we can't make money, we can't help anybody and we can't get this off the ground. And so, I mean, we're for profit, but mostly for purpose. So, for us as a team, it's a hard thing to swallow. But I think, to be pragmatic and real, you've got to push things forward and make money, because otherwise you're not going to be able to help.
I think in the work environment at Nextbar, our culture is very much about your holistic self, and I think just encouraging that in the workplace. And from a business reaching out to consumers, I think that there's a large trend and advocacy growing that everybody wants to live a healthier and better life. So I think just as a business trying to tap into that, ultimately success, what we believe in, is the byproduct of doing business right. So I think it'll lead to better commercial outcomes.
Do you gentlemen think that we're seeing a blurring of the lines between the health and wellness and the preventative, space and the defined area of medical practice? Is there a blurring of the lines that's beginning to occur?
I think there definitely
Absolutely.
should be blurring lines. I think
Absolutely.
the technology enables easier engagement and tracking of health, and I think it's pretty archaic. Obviously, I'm not in that space, but if you think about a lot of medical records and everything being handwritten, I think there's simple things that can get better data by having that transitioned into an online system that can obviously feed better information and lead to better health outcomes.
Yeah, I think the big challenge with that is about adoption at a senior level within the healthcare community. So, you know, it's almost like analog versus digital, where you've got the analog senior clinicians that have brought this massive amount of value to society, and you've got these, you know, the next generation of these super senior clinicians that will influence the rest of the world. And, you know, I think there's a challenge there.
Good.
Yeah, it's an interesting question, and this is probably like the PCEHR. This is the government electronic health record. Really good example of something that had senior authority approval, had zero medical approval. So the doctors just said, this is wasting our time. There was no funding in place. They hadn't taken medical key opinion leader strategies. I mean, essentially, if you want to get doctors to change their behaviour, you need to put some sales or marketing in the pipeline. You need to create a normal funnel like you would for any other business.
So do you see that as just a bad execution of
or zero
another
execution? There was zero
horrific.
execution. They just went straight for the medical authorities, and they got them on side. They did a little bit towards the public, but generally the public was swayed against it, mainly because of fear of breach of confidentiality, but they did zero marketing or advocacy towards doctors. And it was just massive opt-out by the medical profession in general, and I think that's what stalled it.
The other thing you're dealing with is massive sensitive information and data about certain individuals, which obviously presents a particular risk. Talk to us about that risk and any other sort of, you know, abnormal risk that exists uniquely in this space.
Yeah, so medical data is always going to be sensitive. People are worried that, you know, insurance companies might have access to this data, may drop them as a customer because of it. People are concerned that relatives or friends or even people they don't want people to find out about this data may have access to it. So the issue is society benefits as a rule from more big data collection and computing the patient outcome with what the actual patient parameters were. So what drugs they were given, what their physiological parameters were. So we do, as a society, benefit from having access to big data. The key is, how do we de-identify it? How do we persuade the public that it's safely stored and they will never be revealed to other parties? And how do we just collect it centrally with, I guess, some degree of trusting of these senior regulatory bodies?
Ross, Troy, do you have anything to add to that?
Yeah, I think that as a society and globally, we have a massive issue with trust. And for us, you know, the patient is the most important person and it's their data. It's not for other organisations to pry. And so, you know, breach of trust is massive, and it's the biggest risk, I think. And I think we've seen several examples of trust being breached in recent times.
Yeah, well, at Nexpo, we're obviously a fun consumer brand, so we're less about, I guess, the privacy issues. But I think that in the industry that we're in, the ability to understand consumer trends is ultimately what will accelerate better for you outcomes. So I've probably got a different lens that's less.
Let's talk about consumer trends, and we'll finish on that. We'll start with you, Troy. If you look into your crystal ball, what do you see over the next 1 to 3 years, more emerging trends in the health and wellness space?
Yeah, I think it's an interesting one in the food and beverage industry. Obviously, large multinationals have led the way for a long time, and there's been a trend away from sugar to then now a lot of products being artificial. So I think what we want to see is that no sugar, nothing artificial trend. But I think it's also another trend has been the rise of, I guess, challenger brands and people adopting, and there's much more, because of the digital social media age that we live in, there's a lot more consumer buy-in. It's not the old school form of marketing and advertising. It's now giving everybody the opportunity to get behind brands that they believe in. So I think there's a definite trend for businesses that are profit with purpose.
Right. Gentlemen, thank you so much for coming on Entrepreneurs tonight. I think this is a really useful and meaningful conversation, and one that needs to probably be had more often. Thank you very much.
Thank you.
Thank you.
That's all we have time for tonight. Next week, we tuck into new age food and food innovation. You can tune in anytime on Foxtel Go and on the catch-up section of yourmoney.com.au. Thanks for watching Entrepreneurs. I'm Jack Delosa. Good night.